All right, I think we can get started because we don't have much time and we also don't want to take away so much of your time, especially during this time of the year when everybody's really, really busy. So thank you very much to all of you for once again making the time to be with us today. My name is Mariana Santoyo, and I am the GBV and Emergency Specialist for the Sub-Regional Office in the Caribbean. And yeah, I'm very happy to welcome you to our main event to observe the 16 days of activism against gender-based violence, which actually ends tomorrow on the International Human Rights Day. We have been planning this event along with the global gender-based violence area of responsibility and some of our local partners in the Caribbean. And we're very pleased to officially be launching the interagency minimum standards on GBV programming and emergencies specifically for the Caribbean. Many of you may have heard about them before because they were launched last year globally. But this year we wanted to take the opportunity to have a special launch for the Caribbean region, because this is the official theme of the event of the 16 days together with the GBV AOR. And we wanted to share how local partners in the region have been implementing them so far and how this tool has helped them to deliver quality services for GBV survivors. So just so you know, the development of this resource began in 2018 by the GBV Area of Responsibilities Task Team on the minimum standards, the co-chairs being UNFPA, UNICEF, IRC, with members being IMC, IOM, UNHCR, Trocare International, Plan International, Raising Voices, Mercy Corps, CARE, and the GBV Guidelines Reference Group, and WHO. As you see, it's a very consultative and interagency document that has been created here. And the task team provided feedback on the draft of the minimum standards and participated in field testing, continuing as of today to support the rollout activities in the different countries. The development of this resource was highly consultative. There were 14 field consultations held on the draft with over 40 experts who inputted with their perspectives and the technical support and guidance from beyond the expertise of the already mentioned task team. So as you see, this is really a global resource available for everybody, and there has been feedback and inputs from all the corners around the world, and especially taking into account the valuable feedback from people like you working in the front line, right? And your experience was taken into consideration. Let's go to the next slide, please. I'm just gonna take away my camera so that you can focus on the slides, but you've seen my face. All right, so the agenda for today is basically gonna be myself presenting a very brief introduction and an overview of the GBV minimum standards. And for this session specifically, we are going to focus on 3 different standards. We're going to be sharing the tool with you so that you can all access all of the resources available and you can read it. And we didn't want this session to be so technical, but we wanted it to be focusing on the examples from the field and from practitioners who are implementing this so that they can share their experience with you. So we're going to be providing a very practical perspective from the current affairs, the current state of affairs across the Caribbean. The first 2 sessions are going to be about the standard number 7, which refers to the GBV Referral Systems. Many of you have heard a lot about this in the recent months. We've got the opportunity to listen from and learn from Belize and the development of a GBV referral system for GBV practitioners, for non-GBV practitioners, and the general public. We're going to be having the opportunity to hear from Cynthia Williams, who is the Executive Director at the National Women's Commission in Belize. And then we're going to hear from Trinidad and Tobago on the implementation of the GBV referral system, but from a service provider's perspective. So we're going to hear how this system has made their jobs easier in the provision of case management services for survivors of GBV. We're going to hear from Candy Fabienne, who is the Senior Protection Advocate from the Living Water Community at Trinidad and Tobago. Then we're going to cover the standard number 11, which is Dignity Kits Cash and Voucher Assistance. And we're going to be focusing on Dignity Kits specifically, and hearing from Trinidad and Tobago's experience in pre-positioning and distributing Dignity Kits to support women and girls. And we're going to hear from Nigel Phillips, who is the Gender Affairs Officer at the Tobago House Assembly. And then for the last standard that we're going to be covering, we're going to talk about GBV coordination. And we're going to hear how we have been activating a GBV coordination subsector to respond to the Venezuelan emergency in the Caribbean and the countries that have been affected by it. We're going to hear from Tishan Rose Whittle, who is the GBV subsector coordinator under the R4V from UNFPA. So let's go to the next slide, please. All right, so here I wanted to show you a very brief video. So Tommy, can you please help me to go to YouTube and so we can listen to the video, please? Maybe having some technical issues. Tommy, do you want me to share the screen? I have the video ready here. Okay, let me just share my screen just for the video, and then we go back to Tommy. Oh, here we go. Never mind. Tommy, you need to unmute yourself so that people can listen to the video, please.
Gender-based violence.
Can we please start it again? Yes.
Girls in emergencies, and are committed to addressing gender-based violence. Often, you are the first to respond. But you also have questions on how to safely and effectively deliver services. How can I increase women's participation? What is a quality safe space? When is a referral complete? What skills should GBV staff have? How can I better assess GBV risk? Did you know that there is a resource where you can find the answers to all these questions and more? The Interagency Minimum Standards offer clear and practical steps any organization can use to help address gender-based violence in emergencies using a survivor-centered approach. Multi-sectoral response to GBV is life-saving. With the 16 minimum standards, we know what to do to improve the health, safety, and well-being of women and girls in emergencies. Visit the website to find out more, and please like and share this video.
Thank you very much, Tommy, for that. Okay, so this brief video has been developed by the GBV Area of Responsibility specifically for the 16 Days of Activism campaign this year. And just as an overview, the minimum standards have been created to enhance accountability and establish clarity around what constitutes a minimum GBV response. But please know that not everybody needs to do everything, right? Not all GBV actors are responsible for all of the 16 standards. It is a shared responsibility, and we're here to give you guidance on your specific area of expertise. Not we, the standards are here to give you guidance. So always remember that it is best to not do something if you cannot do it right, so as to ensure that we're not doing further harm to the population that we serve. It's always best to stick to your mandate and ask for further technical support if needed. And in this case, UNFPA and all the other UN agencies and the GBV AOR, we are here to provide you with that guidance, aside from the technical guidance that you can find in these resources. There are many ways in which services are offered to the population that we serve. And the idea of the minimum standards is to reduce the variations in the quality of the service that are being provided, while being contextualized so that they can actually inform what you're doing. So by minimum, we mean of adequate quality. For the purposes of this research, adequate quality means reflecting good practices and, as I mentioned, not causing more harm. So as such, each standard in this research represents common agreements on what needs to be achieved for a specific programmatic element to be of adequate quality. While this research defines the minimum, it is also important to understand that a response can go beyond the minimum, right? And we would actually hope that it goes beyond the minimum. And the minimum standards are, just so you know, they're targeting specifically GBV prevention and response partners, including local women's movements and women-led civil society organizations, but also donors, governments, and everybody who has an interest in responding to GBV. Let's go to the next slide, please. So what are the minimum standards? They define what agencies and actors working on GBV programs need to do and achieve to prevent and respond to GBV. It is a field-informed tool that is based on evidence and established or emerging best practices. They are universal standards that provide means to contextualize the implementation of your programs. It recognizes women's participation and partnerships as a cornerstone for effective GBV prevention and response. And it also aligns with already existing tools and are intended to use with other are intended to be used with other interagency guidelines and resources for GBV actors. What are they not? They are not a comprehensive guidance around GBV areas of programming and activities, right? They are not a presentation of new material as part of what is standard. It's not a one-size-fits-all manual. It is not a vertical top-down approach to partnership and capacity strengthening. And it is also not the only resource that a GBV practitioner will ever need, right? Let's go to the next slide, please. All right, so there's no perfect way to group the minimum standards. And as I mentioned, we're not going to go through the specificities of each standard here, but I did want to give you an overview of what you can find in this resource. And I'm going to give you the link where you can download this on the chat. But so just so you understand, so the green standards in these green boxes, they are the foundational standards. So we have the GBV guiding principles, staff care and support, and participation and empowerment of women and girls. And these foundational standards are critical individually and also fundamental to the implementation of all of the minimum standards. And they must underpin all program elements and actions through the keeping into account the GBV guiding principles of safety, confidentiality, respect, and non-discrimination, which aligns with the GBV survivor-centered approach. And then we have the gray standards here that are 10 program standards that provide guidance to respond to, mitigate, and prevent GBV in emergencies. And they are the core GBV programming elements. And lastly, we have the pink squares that represent the process standards, which refer to the collection and use of GBV data, monitoring and evaluation and assessments, and the GBV coordination. Let's go to the next slide, please. So just so you understand a little bit how each standard is structured, right? Each standard provides, is basically what GBV actors must achieve to prevent GBV and deliver multi-sectoral services to survivors in humanitarian settings. Each standard is going to provide you with key actions that should be seen as a menu of options to take to achieve the standard, but also as a means to contextualize the implementation. So the key actions are not an exhaustive list of what you should be doing or should not be doing. It's just a recommendation and guidance. Each standard provides you with some indicators that you can use to measure achievement of the standard. They are not for individual key actions. It's 4 or 5 recommended indicators per standard that you can use. It also provides you with guidance notes at the end of each section to give you a bit more of information and advice on the priority issues that relate to the specific standard and the populations that you're targeting, and practical suggestions on overcoming common challenges that have been identified in the field, or also taking advantage of specific opportunities that may arise. It also gives you some tools, such as templates that you can use and standard forms that you can use and adapt to your programs. And finally, it gives you a set of resources specific to each standard that you can also read a little bit more and specialize a bit more if it's your area of expertise. So let's go to the next slide, please. We've got now the standards, that's the specific standards that we're going to be presenting to you today. So we're going to start with standard 7. As I mentioned, the GBV referral systems. These are systems that are in place to connect GBV survivors to appropriate quality multi-sectoral services in a timely, safe, and confidential manner. Let's go to next slide, please. So how are we in the implementation of this standard in the Caribbean? So far, GBV referral pathways have been developed in 13 countries across the Caribbean only in 2020. With the support from UNFPA, the following countries have developed their pathways, and they're in different stages of the implementation and the development, but they are already heavily invested in this process. And this is a huge achievement that the Caribbean needs to feel very proud of. We've got Belize, that we're going to hear about a little bit now, Guyana, Suriname, Trinidad and Tobago, as well a presenter, Jamaica, Bahamas, Barbados, British Virgin Islands, Grenada, St. Vincent and the Grenadines, St. Kitts and Nevis, Anguilla, and St. Lucia. So yes, Laura, thank you. Congratulations to all of you, because this is a huge accomplishment for the region. And we're very proud of all of you and the countries that are still missing that we hope to be able to add to the list in the coming days. So let's go to the next slide, please. So what is the purpose of the referral systems, right? This is a functional what's going on? Okay, so a functional referral system is survivor-centered, as I mentioned before. Multi-sectoral service providers support survivors' health, healing, and empowerment. These systems coordinate the service delivery, improve safe and timely access to quality services for survivors of GBV, prioritize survivors' safety, confidentiality, and respect survivors' choices, and ensures that survivors are active participants in defining their needs. What's going on? And supporting them in deciding what response and support options best meet those needs. It is It is important to recognize that referral systems must prioritize survivor safety and confidentiality and respect the survivor's choices. And here you can go back to the standard number 1, which refers to the GBV guiding principles. And this means recognizing that even with services in place, survivors may still choose not to access certain types of care. It is always their choice. Let's go to next slide, please. All right, so now we're going to hear about the experience in Belize, and I'm going to be quiet now and let you guys hear from our partners who are actually in the field and implementing this. So we're going to hear from Belize and the development of the GBV referral systems for them. I would like to introduce you to Cynthia Williams, who is the Executive Director of the National Women's Commission in Belize. They have been partnering with UNFPA since 2003. And Cynthia, over to you. Thank you so much for joining us today, and go ahead.
All right. Thank you very much, Mariana, for the introduction, and first of all, also for the invitation. For us, really having a really good experience in terms of the partnerships that we're developing, and in particular UNFPA. So as you said, I work with the National Women's Commission, and I'll be talking briefly about the experience that we've had so far. Can I get the next slide, please? And our process really looked at 3 different views of the referral system. But first of all, a little bit about the National Women's Commission. We are the policy advisory body to government on issues of gender equality, equity, as well as women's empowerment. And so our oversight and decision-making comes directly through our commission board, which is appointed by the Minister of Human Development. And it's comprised of 13 persons from different sectors, including education, even public experience with public awareness, security, health, and so forth. One of the other areas that we also work through within the commission board is the interaction of subcommittees that provide additional technical guidance to the Secretariat. And these are 3 subcommittees that we are part of, which are the monitoring and evaluation, information, education, and communication, as well as policy and legislation. And the key thing with these particular subcommittees is that we share them with the National Committee for Families and Children, which is a statutory board that looks at issues dealing with children and families and look at the implementation of the Convention of the Rights of the Child. And so we're really trying to see how we can build resources and combine the different expertise, the areas, for us to be able to address these issues from a multi-sectoral level. And having partnership with the other statutory body allows us to also integrate gender issues within the work that they also have. So that's why we were able to now integrate ourselves as a National Women's Commission into their subcommittees. And so, like I said, the Secretariat is comprised of 2 technical staff, myself as ED and the program officer, as well as support staff. And we basically implement the decisions and any activities that the Secretariat on a whole has to do in guidance with the board. However, the other oversight mechanism that we also have is the National Gender and Gender-Based Violence Committee, which really looks at bringing multiple entities from government, civil society, even the UN system together and approach the national response to gender issues from multi-sectoral level. And it includes representatives from the police, from health, from human development, education. They have 2 bodies representing NGOs and civil society, as well as the Office of the Ombudsman, a seat for the National Committee for Families and Children as well. And of course, we also have one representative representing the UN systems that are present in Belize. And so really and truly, this committee addresses gaps and challenges that come from the national and local level, and is able to then link with the necessary entities that respond directly to these services. As a body, the National Women's Commission does not provide direct services, and so we really work at the policy level, at the macro level, in partnership with the different government departments and civil society that are present in Belize. So we really provide the coordinating mechanism for Belize as a country, but not only at the national level, we also do it locally through the district committees that were formed in 2017, which also include representatives from the various government entities that provide direct response, as well as specific entities that are present in those specific districts. So every composition of the district committees really are a reflection of the district itself. So that in and of itself is a very quick synopsis of what the National Women's Commission is and what we do. Next slide, please. So the first thing that we did, even though there is a process and there has been partnership for many years where there are the different bodies respond to issues of violence, such as the police, Ministry of Health and Human Development, as well as judiciary. One of the things that we did very early on, particularly during COVID, we recognized that even in this day and age, there are still a lot of persons that they're not aware of where they can go to access services or at which point they can enter the pathway. And so the first thing that the National Women's Commission did is really try to explain through the graphic that you see in the presentation, what are the different entry points, who are the different service providers, and what are the things that the persons can expect when coming into contact with these service providers, and really to help them understand that it can be at multiple levels and they can access multiple levels of services as well, that they doesn't have to come only through one, to really help them be able to understand the different options that they have. So we were able to develop this, and we have been sharing with the larger population in rural communities as well. And as a result of this particular image, we also developed a friendly version through the support of UNFPA as well. We were able to distribute it and share it. And we did that in different languages, Spanish, Creole, and English as well, to be able to make it in a friendly version that has more a simplified image for the general public. So we have both images, this one and another one that we can also share with you guys afterwards. Next slide, please. Right, so if after we finished or after we had completed that particular referral pathway for the general public, one of the things that we also worked very closely was the gender-based violence service mapping exercise in partnership with UNFPA. And so a lot of the data collection was done by UNFPA. And if you can see from the different areas that were included, things that were important to include to ensure that we have all the information in the different districts in regards to the different entities, because one of the things that we recognize is that we still unfortunately don't know all the services that are being offered by multiple entities. And so this process really will facilitate having that awareness and being able to share it with the partners in all the districts and the persons that actually work, so that they can also refer persons within their own districts. So we had to ensure that they include the region and the area of operation for each of these entities, as well as an address so that people know where they can go. So they have 4 different areas. The where is it that the people can go, where these services are being offered. So we have the region, we have the address, remote service provision, whether this is something that they're offering, particularly around our situation that we're living right now, being a pandemic. So we had to include that as well, whether these entities offer support through a hotline and what type it is, and they needed to also include that information. The second aspect of the mapping exercise that was done was who are these organizations? So what are the names and who they're normally funded by? We also had to ensure that we document what specific services these different entities are offering. And so it included the sector, whether it was direct concrete gender-based violence services, or whether it was more social support, whether it was legal services, and even going out to specific services that each of them offered, what were the opening hours for the different entities, as well as what were the arrangements that these entities were making for their clients and for the persons that they serve in regards to the next 3 months. Particularly, this was done very early on in the pandemic, so we were able to really get that information from them, as well as, of course, gaps that they can indicate in terms of how they are dealing with it, and being able for us as a national coordinator to also be aware of what those gaps are, and additional notes that they would have wanted to include as well. And of course, the final one, it's looking at really the population that they're going to working with. So it's whether they're serving women, girls, boys, or men, elderly persons. So we really try to be very specific to know who are the population that these different entities are serving. And so once all that mapping was done, we really look at the entire overview and whether we needed to add anything else, but we felt we had really done a substantive amount of work in terms of capturing what was required. After that, we had a validation process with the different providers. So even though we had done the mapping, there was a second wave of interaction with them to ensure that the information that was inputted was correct, as well as validation through entities at the national level as well. And of course, in these type of processes, we always have challenges. And so some of them included, the timely response, because being in the middle of a pandemic, and a lot of these entities trying to really mobilize from afar, or trying to develop new strategies so that they can continue to support the work, we had to it was very time consuming, and there were multiple responses. But some of the benefits really is allowing for all this information to be shared with everybody across the board. So even though you might be in the area of Toledo, you still would be aware of services that are offered, in the Orange Walk district and so forth. Next slide, please. And so one of the things that we were able to do is really be able to map all these services by district. So we were able to know what each district had, whether they had in terms of food provision, whether they had legal services, whether they had support for legal services, medical, and also included for us to be able to identify all the entities that were present in each of the districts. And so these, of course, allowed us to increase the number of stakeholders. And as a coordinating entity, it allows for us to be able to build other partnerships, and be able to recognize and be aware of how extensive the services that are being provided, but in a way to see how we can minimize duplications and how we can provide support for each other as well. Next slide, please. Right. And so when we look at the development of this referral pathway, one of the things that we had to do through the review and validation process is that UNFA really did quite a lot of work in terms of drafting the actual pathway. And then afterwards, it was presented not only to us, but also to different stakeholders, particularly those who are providing those services at the government level. And once that was that, we allowed some time for the different stakeholders to review it and being able to provide some input. But we felt that we also needed to have that discussion being done virtually. And so we also did that as well. And then once that was done, we also look at what the layout of the referral pathway would be, because it is quite a lot of information. So we had to ensure that we can do it in a way that it is really simple and people are able to understand what the process itself is. And so we were able to come up with the 3 main areas that were going to be included in the referral pathway. And these include the immediate response, so that frontline personnel understand that these are the services that they have to do immediately when the persons come to them, as well as any follow-up and other services that may not be immediate but are still required by this person seeking assistance and support. And the third area that we were looking at is really the district pages that itemize what services each of the districts have. So all of these documents would be one document that would be distributed, and the different districts would be aware what is present in their particular district as well. Next slide, please. So these, and I hope you guys are able to see the process itself, because it really provides that guidance for the personnel to be able to look at what exactly is it that they have to provide during the immediate response. What are the things that they need to do versus what are the things that they should not do, and reminders as well in terms of the always practicing the survivor center approach as well. And of course, ensuring that on the second step that the survivor is given, has given informed consent, and that the immediate response should then be able to be provided, be able to prioritize as well. And if there are any other, there are no urgent health and safety or security needs, then this is where the follow-up and other services would come in. So there are three main steps to the referral process, which it's clearly outlined for the different frontline personnel that would be using this. Next slide. Next slide. And of course, we look at the final aspect of the referral pathway, which is then developing a constant companion. So these are small pocket-sized booklets that outline what people can do in terms of whenever they want to provide that support. And these are specific for non-GBV specialists. So these are for community members. And it clearly outlines for them what they do if somebody comes to them, versus someone who is just from a third party coming to make that particular request to support. And it really outlines which process or where they can go. And it also includes, again, what they can do versus what they can do. And of course, the different locations that is important to them. And this is in process because we're kind of using one of the constant companions that have been developed. And so one of the things is using the local lines for us, the local information that we're currently changing right now in Belize. Next slide. All right, and so basically, in terms of all these processes, always looking at what are some of the things that we have learned versus some of the challenges. As I mentioned briefly, the validation of data by service providers was time consuming, and it really took quite a while. And a lot of the issues that we had to deal in terms of the validation process as well is that often being able to bring them together for that official validation process was difficult, especially during this time with COVID, because often you find that it's the same persons that you have to speak with that are the ones who have to come to these meetings. And of course, something that probably that everybody has experienced, and I'll take it from my friend Tisa here, who likes to say it, and I do agree, the fact of how does working within the COVID-19 pandemic has changed the way that we do and how tired we are. So really and truly, virtual meetings have become virtual vampires that suck out the energy from us. And that again was a challenge. And the fact as well that in terms of mandatory reporting laws and practices, in Belize currently, they only look at mandatory reporting of issues with children, not with adults. And so that is a difference that I think we have to look at, because often persons who might want to make a report on behalf of someone else, they're unable to, and even persons who go and make reports, often they also have the choice of removing it. And sometimes people feel that there should be a mandatory reporting law even on issues of gender-based violence for adults. But at the same time, I think the experience has also been able to expand multi-sectoral engagement for us and be able to bring in partners that maybe in the past where we were not working as closely. It has really helped us to identify shared outcomes. So looking at the different policies that different entities, different sectors have, and aligning to each other, looking at national documents such as Horizon 2030, GSDS, National Gender Policy, and the Action Plan, and being able to really align what are the different outcomes that are similar pillars so that we can all work on them together. It has really helped us to be more inclusive of the units and departments within a ministry and help them to be able to get to know more information that maybe they did not have in the past, as well as really help us to understand that the roles and responsibilities of multiple stakeholders, because often we don't have that information, and that we often can be judgmental and we can be very critical. So this process also helps us to understand what are the roles and responsibilities of the various stakeholders and how can we work better together. And of course, all of that looks at building stronger partnerships that at the end is what we're seeking, because we recognize that that's the only way that we'll be able to really advance the work. Next slide, please. And so really for us now, as we still are undergoing the process, but in terms of the next steps for Belize is launching the referral pathway officially, and being able to promote it and being able to share with the frontline personnel, being able to share with non-GBV specialists so that they have the information. And we hope that that would be able to be disseminated nationally, locally, through the support of not only the district committees, but also through the community policing who are also present even in communities that we ourselves might not be able to reach. And so we're trying to build that partnership to support that dissemination and being able to build capacity by sector to ensure that they understand and are able to know how to use this referral process, and even in terms of the non-GBV specialists to know how they can also use the constant companion, and that is also part of our next steps, as well as ensuring that we conduct annual reviews and updates of these documents, because things are changing. Our organization may able to include more services, or due to funding they might decrease or cut some of the services. So we need to also be aware of reviewing and updating this information so that frontline personnel have it at all times. And of course, looking at the monitoring component, which sometimes is always a challenge, or that's the area that sometimes we might not do as much. And one of the ways that two ways that we've decided we can do that is through the gender-based violence complaint mechanism, which was recently launched in Belize. And this complaints mechanism is an opportunity for persons who are making reports with the different service providers. If at any point they do not receive those services, they can file a complaint directly through the National Women's Commission, who works with the National Gender and Gender-Based Violence Committee to launch an investigation to find out why is it that services were not providing, looking at the gaps and being able to address it at multiple levels. On the first instance is looking at the institution itself, and if that doesn't work, being able to take it out to this at the CO level and even at Parliament, because we need to be able to address it as we recognize it. And one of the challenges before is that there's been a lot of narratives of the gaps, but we have not really been documenting it. And we hope that the gender-based violence complaint mechanism will support that documentation and have concrete evidence of what is working versus what is not working. And of course, through the National Gender and Gender-Based Violence Committee, who have representation of the different sectors and entities that provide services, to be able to take ownership and accountability and be able to address those gaps even at the first level. So those are for us the next steps. Next slide. Well, that's basically it for us. But really, I think for us, the overall experience is we've really had a lot of support from our partners. So for us, it's really something good that we've seen. I would like to commend them for their active engagement, even in spite of COVID. Whenever we call them, they come to us, even depending on the time that it is. Even though it's been a challenge, they have been really open. You know, the support of UNFPS also has really been very instrumental in the work that is currently being done. And again, is looking at how do we link past interventions currently and to future interventions, because these systems are actually also linked to protocols that have been developed in the past. So thank you very much. And sorry if I passed the time.
Cynthia, thank you so much for that really, really inspiring presentation. And I just have to say that we are very proud of Belize and how you have been taking on this huge task. It's really a best practice to highlight, and I really do hope that through the recording of this presentation, other partners in other regions in the world can learn from your experience. So thank you so much for your time and your investment. It was a really interesting presentation. And now I think it's a perfect timing to introduce from a different perspective. As I mentioned before, we wanted to have the perspective from Belize at the national level and how the pathways have been developed throughout time. And now for Trinidad and Tobago, I would like to shift that approach and to start thinking from a service provider's point of view and how these pathways are actually changing the way that we are doing our work, right? So it is my very great pleasure to introduce Candy Fabian, the Senior Protection Advocate for the Living Water Communities in Trinidad and Tobago, sorry. They have been partnering with UNFPA since 2019. And yeah, so Candy, over to you. Thank you so much for being with us. And I'll just, yeah, over to you. Thank you.
Thank you, Mariana, and good afternoon to everybody. Thank you for your time joining us this afternoon. So as my colleague Mariana mentioned, I work with the Living Water community and in particular the Ministry for Migrants and Refugees. Now, what is the Living Water community? I'll just give you a little bit of a background here before we dive into the meat of our experience with the referral pathway. So the Living Water community is a Catholic lay ecclesial community. We are an NGO. We were established in 1975 and we are headquartered in Trinidad and Tobago, but we also do have missions in St. Lucia, Dominica, and Barbados. And just to give you a little bit of an idea of the services that we provide, we offer reception services, so that's pre-registration for asylum seekers in Trinidad and Tobago, psychosocial care, case management, emergency shelter, education programming, and public awareness and advocacy. So that is just some of the services that we offer. So I will jump into now our experience with the referral pathway here in Trinidad and Tobago, and I'll just go ahead and take my camera off so that we don't lose focus. Next slide, please. Thank you. So we established the referral pathway in Trinidad and Tobago in a formal way via the assistance of the Office of the Prime Minister, and in particular the Unit of Gender and Youth Affairs. So we conducted, with the assistance and the coordination, the guidance of the UNFPA, a service mapping. And of course, it is noteworthy that this has since been updated to respond to COVID-19 context. Can you click for me, please? So to get to this point, there have been 3 virtual service mappings conducted, and this has been a multi-stakeholder mechanism of the OPM, Office of the Prime Minister, as well as multiple other GBV service providers. Click for me, please. And so once we got through the conducting of these 3 virtual service mappings, we were able to successfully launch the referral pathway in Trinidad and Tobago. So if you click for me, you'll see a list of all the different agencies. Yeah, of all the different agencies that came together, and it's a well-rounded collaboration. As you can see, we have the National Children's Authority in their Living Water Community, Trinidad Service, and some other names that you might be more familiar with. We have the UNICEF on board, IWEM, UNHCR. So you can see that it certainly is a multi-sectoral approach to the referral system in Trinidad and Tobago. Next slide, please. Thank you. So I'm going to talk to you a little bit about the GBV case management improvement that we've been able to experience via the use of the referral pathway. So before implementing the referral pathway via the UNFPA's guidance, we found it to be a bit cumbersome and difficult, a bit awkward to maneuver through the network of service providers in Trinidad and Tobago. It slowed us down. It was informal, it was non-centralized, and for the most part, it was based on individual networks. So I would have my own network of services and agencies, and I would rely on that. And then another colleague, they know it might be different for them. So it really was, not very centralized. It was also a heavy burden on the survivor themselves to access services. It oftentimes included the survivor having to retell their stories to multiple partners. And we know that re-traumatization of these experiences does not necessarily follow the do no harm principle. So we were really, really grateful when we were able to finally establish a formal referral pathway in Trinidad and Tobago. What it has done for us, it has allowed us to shorten our response time with the use of focal points, especially in case of an emergency. You need to respond now. So knowing exactly who to go to for the particular service you want has definitely allowed us to increase our efficiency there. It has improved the quality of care that we offer to the survivors, and not just quality of care and services, but we've been able to increase the number of survivors that we're able to service and care for. It has allowed a streamlined response and greater transparency in our response. We've been able to mitigate the re-traumatization of the survivor, which is really, really important. So we're really grateful for that. And also we've been able to increase contact and assessment of survivor needs. And this one is really important because needs vary from survivor to survivor. So if we are able to assess what the needs are, we can respond more appropriately. So I just want to chat to you now about the actual referral pathway. Next slide, please. Thank you. Right, so this is an example of what the actual referral pathway looks like in Trinidad and Tobago, or the GBV referral pathway. As you can see, multifaceted, multi-sectoral, right? So for example, a survivor or a victim needs to access a protection order against the perpetrator. It's very simple, very clear. There are telephone contacts, right? And these telephone contacts, as you can see, they're all hotlines. So any time of day, they are able to get the guidance and the information that they need. You'll see here safe house accommodation and all the different areas that a survivor or practitioner might need in order to respond to an emergency like this. So this is really useful. You can get your hands on a copy of this from my colleagues at the UNFPA. And also useful to note is that this is also available in Spanish. So us having to respond to the Venezuelan crisis here in Trinidad and Tobago, we've had to have more and more, we've had to have our documents available not just in English, but in Spanish as well. Next slide. So I just want to chat with you now about lessons learned and challenges. So it's really been an experience for us at the Living Water community. So some of the lessons we have learned Updates to focal point information, hotline number changes, or organizational changes should really be immediate. We should ideally be updating the referral pathway with any of these changes immediately, because when responding in an emergency context, you really need the most updated information. You don't want to have to spend time figuring out, well, what's the new number or who's the new focal point, you know? So that has been a really important lesson for us. Referral pathways should be easily accessible to key partners. So easy access, super, super important. You know, and some of these things that we do in the office at Living Water Community, we would print out a physical copy of the referral pathway and we stick it up on the wall, you know, so it's even easier now. You just turn your head and you go down the list and you see exactly what the number you need to call or the person you need to get in touch with. So that has been super, super helpful. And then staff should always be trained on use of the referral pathways. It doesn't make sense you're having it and it is such a useful tool, but then you have a new staff member or somebody else joining the team and they've not been trained on how to use it. So it, you know, it defeats the purpose. So that was a really good and important lesson for us. Now, we don't have too many challenges, but one of the most important, the most serious challenge for us is being able to keep up with the ever-changing context of COVID-19. So for us, when COVID-19 just struck, it was really tough because we had to respond almost immediately to something that we never had to respond to before. And this was, you know, just trying to figure it out internally, far less for updating our partners at the UNFPA was so difficult. We were scrambling, we were trying to see, okay, we need to establish a hotline. Okay, what do we do now? How do we allow people to get in contact with us if we have to close our offices? You know, so day to day, it was always changing, and especially in Trinidad and Tobago, our context has changed so many times. We've had to be in lockdown, and then we would open back up, and then we were in lockdown again, and then now we have a semi-open back state. So always changing. So that has been one of the most difficult challenges for us. But again, one of the lessons that we learned was, as things change, update. So that's been really helpful for us. So now just to chat a little bit about the next steps. Next slide, please. So next steps for us include continued dissemination of referral pathway and relevant updates to partners. So building awareness, increased awareness of the referral pathway so that all practitioners have access to it, and not just access it, but access to the most updated version of it. We also want to look at revisiting the GBV pocket guidelines to ensure that it is also up to date and relevant in the context of the COVID-19 pandemic. So that brings me to the end of my presentation and me sharing our experience, not just at the Living Water Community, but in Trinidad and Tobago as well. I hope this has been useful to you, any of you who are currently, building upon your referral pathways or have been using it for a while. You're not alone if you've had challenges. You're not alone if, you've had to learn some really tough lessons along the way. We've been there, we've done that, and we're still going through it. So thank you so much again for your time this afternoon. It was lovely to be able to share with you this afternoon. Thank you. Mariana.
Thank you, Candice, so much again for another wonderful presentation. It was really, again, inspiring to hear your perspective from a service provider's point of view and how this resource has actually helped you providing better services and showing up better for survivors. So congratulations to you all for the amazing work that you're doing. on developing and implementing and following referral systems in your countries. And now, Tommy, if we can go to the next slide, please. All right, so now we start with the standard 11, and I promise we'll go very fast. I know that we're going a little bit over time, but I think it's important to hear from the people in the ground, right? So, okay, so standard 11 refers to Dignity Kits, cash and voucher assistance. So this standard means that women and girls receive dignity kits and/or cash and voucher assistance to reduce GBV risks and promote safety and dignity. Next slide, please. So how are we in this, in terms of dignity kits, especially in the Caribbean? So just so you know, and you're all aware, UNFPA has strategically pre-positioned dignity kits in Antigua and Barbuda in collaboration with SEDIMA, which are basically ready to be shipped and distributed across the Caribbean in case of an emergency. In this case, for example, it could be a hurricane, right? And we've just passed the hurricane season, which thank God it was not as bad for the English and Dutch-speaking Caribbean, but these resources are available for the Caribbean countries. Dignity kits have also been prepositioned specifically in Barbados, Belize, and Jamaica, and they have been already distributed in Guyana and Trinidad and Tobago in response to the Venezuelan emergency, and also in Bahamas in 2019 for the hurricane response. So let's go to next slide, please. Perfect. All right, so what is the purpose of a dignity kit? And I'm pretty sure many of you have already worked with dignity kits, or you already understand what dignity kits are, but it's important to remember that dignity kits can be used in the context of, and should be used in the context of GBV programming in the following ways. So they should, first of all, be used as an entry point to begin working with women and girls to identify GBV risks in the community. It is not meant to identify GBV survivors, because we know this is not a good practice. It's in order to identify the risks. They're also used to raise awareness and encourage communities to engage in discussions around important topics that they may be dealing with, such as preventing and responding to GBV. They're also used as a tool to share information on where women and girls can access GBV and life-saving services. They're used to reach women and girls at risk, including those who are surviving GBV, particularly pregnant and lactating women, and to ensure women and girls know and are aware of where they can access the available services, especially during an emergency, right? They're also being used in many countries as an income generating activity for women and girls who are affected by the crisis. And in addition to important economic support, bringing affected women and girls together for the assembling of the kits presents also opportunities for awareness raising sessions and other group activities, which can also support to their healing, networking, you know, psychosocial support activities, informal psychosocial support activities. So the idea of the dignity kits is to provide essential supplies in the bucket or the bag of the dignity kits that we as humanitarian actors can help enable women and girls to use the already limited resources that they have to purchase other critical items such as food, right? Or many times when we provide this to mothers or single mothers, or, you know, lactating women who are, or those women who are pregnant, they can actually use the money, the little money that they have or the resources to buy, you know, the life-saving food and even items for themselves and their families, right? So they don't need to worry about their personal hygiene. So it is important to understand that preserving dignity is essential to maintaining one's own self-esteem and confidence, which are critical to protection and coping in a stressful humanitarian situation, right? Just as a highlight, the distribution of the kits it's an opportunity to meet and speak with women and girls to provide the necessary life-saving information and to better understand their concerns. The dignity kit distribution should not be a standalone activity. It has to be accompanied by explanations of what the items are, how to use them and their disposal, because we want to be sustainable and green as well, and with discussions regarding safety, information of the services available, and awareness raising on rights and hygiene issues. It is also an opportunity to meet with girls and talk about risks, right? Without broadcasting that we're talking about GBV, which is not really a good practice. We can talk about, hygiene issues, and then we take the opportunity to understand what their concerns are around their safety and protection. The only exception to this is when dignity kits distributions are undertaken in acute emergency response activities, right? So during the first days of the emergency, you don't really want to have conversations and focus group discussions with women who have just been affected by a hurricane, right? They don't have time for that, and we don't want to overburden them. So this would be the only exception. But in general, the dignity kit distribution and the provision of these kits should serve as an entry point to broader the GBV programming and response services. Let's go to the next slide, please. So now we're going to hear from, again, partners in the field. We're going to hear about the experience from Trinidad and Tobago's pre-positioning and distribution of dignity kits to support women and girls. It is my great pleasure to introduce you to Nigel Phillip. He is the gender officer at the Tobago House of Assembly, and they have been partners with UNFPA since 2011. So Nigel, over to you. I think you're here. I'm not sure if you've put your camera on yet. Nigel?
Yeah, I'm here.
Oh, there you are. Okay, now I see you. Sorry. Okay.
Are you see me?
I think you have your camera on, but I cannot see you. But
I'm seeing you. Yeah, well, again, thanks for that introduction, and thank you for the past two presenters that would have went before me, and a really great presentation. A little bit about myself here in the Division of Health, Wellness and Family Development, which is the Tobago House of Assembly, and the gender unit is based within the Division of Health, Wellness and Family Development. So a little bit about Tobago. Tobago is separate from Trinidad, but it's one island, Trinidad and Tobago, but Tobago has a population of 60 to 62,000 persons living on the island of Tobago. So the gender unit, mainstream gender, in all of its activities throughout the 10 divisions in the Tobago House of Assembly, which addresses the needs of men and women and boys and girls where possible. It is made up of 3 persons in the unit, and within that unit of gender affairs in the Division of Health, Wellness and Family Development, we have various psychosocial support to deal with issues that are affecting women and girls, from counseling to therapeutical counseling, psychologists, and various type of counseling that we offer here within the unit. So let's go into the slide that I am going to be speaking into. Can I have that slide up, please? Okay, so during the COVID period, which would have been from March to presently, which we are going through right now, and I saw that my other colleagues would have presented on such, and even from Living Waters. Now, one of the issues that was the gender unit was faced with is that in any crisis, as you all know, that women and girls are mainly affected in any sort of crisis. So because of the whole COVID period, what would have happened is that many persons were thrown out of jobs. Women were thrown out of jobs, they didn't have their jobs, they lost their jobs, or their jobs would have been put on hold. So we would have had persons coming into the gender unit in the office, and we would also have social workers on the fields that are working within the various communities out in different villages in Tobago, and you were finding that persons were needing personal items. Even though the division would assist in some of these items, there was still a challenge of providing these items. And this is why we would have called on our partners, one of our partners, which is the UNFPA, and they was able to help in gathering the service to assist women and girls on the ground. So some of the things that they would have really wanted would have been things like sanitary napkins, detergent to wash, and toothpaste. They have combs and these different things. So they were able to provide the kits for us here in Tobago at the gender unit. And how those kits are normally distributed. Normally we have a whole array of persons coming through the office with these various gender needs, especially women and girls. So they will come for food support. They'll come for support in terms of persons who are going through domestic violence situation, or even gender-based violence situations where they're having issues in getting that, the basic necessities. They will come for assistance. So the kits, as you would have seen here, would have composed of the comb, the menstrual pads, the bath soap, the backpack, or the bucket in that case. And those would have helped persons who are living within the rural areas and also the urban areas as well. Because in the rural areas, you would have had persons who are living in certain communities or in the area where they don't have running water, where they can use the bucket to assist them in providing water for their family. And because of the lack of electricity as well, the torchlight was a good initiative of they having to access that they can use a torchlight in terms of clarity, in terms of getting from one place to the next using that light. So basically, the dignity kit didn't just go to persons in those areas, but I heard my other colleague would have spoken about the migrants, because we would have had migrants who are residing on the island of Tobago, who normally would leave, who is leaving from their country and coming to live in Trinidad and Tobago or moving to Tobago. They come with bare necessities. So they come without any, maybe very few clothes on their back, very few personal items, and they may run out of those personal items. And those dignity kits would have go towards that, along with the Division of Health, Wellness and Family Development in the gender unit, but also help us sometimes with food vouchers that will accompany the kits, that they would also, it's like an enhancer to the kits, so that these persons could have other needs met, like food requirements, to go with those kits. So we have the various NGOs on board, because the gender unit work with all the different NGOs on the island, the NGOs, the RBOs, and the community-based organizations. So we network with everybody on the ground to see what is in need, and those needs are normally feedback to us in the division here. So can we have the other slide, please? Right, so that picture there is the buckets, and the buckets would have comprised of what was put up there, highlighted in the slide before. So in that same bucket, we would have received 60 buckets, approximately 60 buckets, which would have comprised of the comb, the torchlight, the rag, soap, and some of those various things, sanitary napkins for women and these things. So the bucket will comprise of those things that would have aid in the need assessment of the persons who are acquiring these kits. Next slide. Right, so it says here the dignity kits pre-positioned at the Office of the Prime Minister and Gender and Youth Affairs. Now that is under the ministry in Trinidad. However, for M&E, monitoring and evaluation of those kits. Now, when we would have received those kits here in Tobago, in the gender unit, the kits were stored within the Office of the Administrator, where it is where you will have accountability on how those kits are distributed. So if persons have to access one of those kits, you have to sign, or persons who was giving it out, you have to sign and give a summary of what was the purpose of giving the person the kit. So you will have that accountability in terms of where the kit is going and the need assessment of the person that is attending to in receiving those kits. Whereas persons who are admitted to the shelter, like DV survivors, domestic violence survivors, who would have been admitted to the shelter, the kids would have come in very crucial in that particular area where sometimes they have to run from the violence, and then therefore they come with bare necessities into the shelter, and the kit is administered or given to them. However, we would have had cases where a pregnant girl, 18-year-old, who would have been a recipient of that kit, where she was admitted to hospital due to the abuse that she was receiving. And the kit would have came in handy because she would have needed things like the personal, like underwears, that was also part of the kit. You know, so can we have the other slide as well? Okay, one of the main things here, and you would have seen here the barriers or some of the challenges that we would have had, especially with the migrants, is that Trinidad and Tobago is an English-speaking society or country. And having the influx of these Venezuelans, it has become a challenge in terms of understanding what their needs are and how those needs can be met. So the language barriers was one of the main challenges when you're having to deal with the migrant population where persons don't understand the Spanish language. However, sometimes with the help of a translator, we would have also have IOM, which is one of our partners in the gender unit, would also provide that sort of service that if we can't understand and they come to us or they've been referred to the gender unit, then what happens, they would do the translation. And one of the other barriers, because you were talking about, or persons were mentioning going out into the various communities and villages and those aspects. But remember, we're in a COVID period. And because of COVID, we also have to consider the various officers, or we had to consider ourselves in how we maintain the health aspect in protecting ourselves as health officers, and also having to not to come into contact with thinking that persons may have COVID. So in maintaining COVID health protocols, we have to bring that into high consideration in how we deal with the public, and keeping in mind how can we keep the health protocols to where COVID is concerned. Next slide. Right. So we have here, let me just bring this down, key considerations. So it has here, provide information prior to the distribution, what, when, where, and how. And I would have indicated earlier on is that persons would come into our office, we would have NGOs, we will have various groups referring persons to us where we can assess and also assist with those kits, and also to assist with other like vouchers, food vouchers that will enhance the kits so that they can be assisted. We have organized distribution in location that persons can access and where they can safety is ensured. I would have indicated regards to where we have shelter assistance for persons of survivors of domestic violence, that we will have them housed there. However, sometimes locations, if you were to get to those persons, sometimes the location can also be challenging, especially to where that person lives, if it's live in an area that is not easily accessible. So that could be a challenge, and there could also be a challenge of persons coming to obtain these services, even though they are in need of those services. So sometimes the challenges will come with regards to that. But however, the community social work workers, or in that particular unit, they are in the various villages, they are within the different communities out there in Tobago. So even in their assessment, they could also indicate what are the challenges that faces women and girls in those areas. We have the prepare the activity tools, distribution list, pre and post activity survey to ensure that disaggregated age and gender data can be collected. And every kit that was given out, we would have had personal data taken and to justify on how those kits were distributed. So it's not like it was distributed on anyone or anybody come, they got a kit. It wasn't anything like that. It is that you have to meet the various criteria in terms of what is expected in order for that kit to be given to you. So we have here equipped distribution on personnel with referral pathways and other key knowledge on product of gender-based violence service provision. And the thing about this last point here is that the division where I work, it is comprises of not just the social aspect, where we're dealing with the social aspect of persons who are coming into us, but we also deal with the health aspect of it as well. So it will have like the hospital or the mental health unit, HIV, and all these different things are included in the particular unit. However, the gender unit cuts through every single division in the Tobago House of Assembly. So even though it is that something that need other attention in the Tobago House of Assembly, we can do referrals to various agencies where they can get the required help. I think that is it to that particular slide, or is could you go again to see? Okay, so that is the end of my presentation, and I'm glad that I'm able to present on the behalf of the Tobago House of Assembly, right? And even to say in the gender unit, it's just 3 of us. I'm heading that particular unit, and therefore responsible again for all the various gender issues that are on the island of Tobago. And thank you again, and thanks for having me.
Nigel, thank you very much for sharing your experience. It's really good to see how so many standards are being implemented in Trinidad and Tobago, and how you guys are really, you know, up there doing the work. Thank you for sharing your experience. It's really interesting to understand the challenges, of course, that you've had, because we don't expect everything to be solved immediately, but also the lessons learned and how you have followed the standard and been able to provide adequate services to survivors and to women and girls who may be at risk of GBV. So great work. Thank you so much for being with us today, for lending us your time and your voice. And yeah, thank you again for your time and for being here with us. So now, just to go also a little bit quicker, we're gonna go into the third standard that we're gonna cover today, which is standard 15, talking about referring to the GBV coordination. And I would just like to ask you just to do a little bit of an interaction with us very quickly. If you guys can just share with us a little bit, how does coordination work in your context? How do you, or the available actors and your governments or the UN agencies or whoever is leading the GBV response in your countries, how does it work for you? Just one sentence or one word that you can share with us so that we understand a little bit who's joining us today, from where you are, and yeah, if you actually have a coordination mechanism active in your countries and in your regions. If not, and if it's working or not, while we hear as well from our experience in the region. This one is more about UNFPA's support that we're providing in the region, but we're doing it together with the GBV AOR, of course, with the technical guidance of the GBV AOR, and under the Response to Venezuelans platform. Let's go to the next slide, please, while everybody starts to share a little bit with us how they're doing coordination in their settings. And I see here from Guyana, continuous communication. Yes, that's a very important one. The Belize Crime Observatory values our partnership with the National Women's Commission. We provide data and information on GBV from key sources in the Ministry of Home Affairs. Interagency collaboration is vital. Yes, yes, and we're gonna see that now. Interagency collaboration and communication is really, really important for effective coordination. It's important for us to, sorry, I was just saying that you will not, sorry, just to let you know that you're not going to be able to unmute, so please just write it down on the chat. Sorry, I didn't say that, but write down your feedback on the chat. It is important to understand that, of course, collaboration means sharing information, right? Communicating, not keeping everything to ourselves, communicating. It is interagency. We include not just, you know, government partners or UN agencies, but also civil society organizations, volunteer-led organizations, everybody who is playing a role in the response to GBV and any other sort of of issue, we need to, all of them need to be involved, right? We need to talk to each other and share information, resources, guide each other, and share what we have been doing here today, right? Good practices from the region that we can, perhaps another country can see and identify as an interesting opportunity for them to implement in their countries, right? So just how are we in terms of GBV coordination official mechanisms in the region, right? There is currently no sub-regional coordination mechanism in the region at the moment, right? We have had some activations of these coordination groups when there's been an emergency, but usually this is being led by the national governments, right? So it's not a sub-regional whole coordination group specifically on GBV. It's basically led nationally at the moment, right, in the Caribbean. But because we have had to respond to the emergency arising from Venezuela, which is affecting different countries in the Caribbean, the R4V platform, Response for Venezuelans platform, which is the coordination body for this whole emergency response, which is a huge one, and it's you know, close to Syria, Yemen, you know, this type of emergencies, protracted emergency as well, we need a coordination body, right? So during 2020, and in coordination as well, as I mentioned, with the R4V and the technical support from the GBV AOR, we have been able to activate a sub-regional GBV subsector in the Caribbean. And this body covers Guyana, Trinidad and Tobago, Aruba, and Curacao. And these are specifically the countries that are affected by the Venezuelan emergency. In addition to that, specifically for GBV, I know there's many other different groups, we've also been able to activate an interagency and national GBV working group in Guyana, which is currently being co-chaired by UNHCR. Again, interagency is key, right? The person who is leading the GBV working group in Guyana is also here with us today. She's based in Guyana, of course, and she's named Wemis de Florimonte. She's unfortunately not presenting today, but we will have the opportunity to hear from Tishan Rose. She is the sub-regional GBV coordinator, and she's going to be sharing with us how herself and in coordination with the R4V and our IPs and the national governments and other UN agencies have been able to coordinate the GBV response to this specific crisis. So it is my great pleasure to introduce you to Tishan Rose. She's doing an amazing job here. I'm pretty sure that many of you know her. So please, Tishan, it's great to hear from you. Go ahead. You can give your presentation. I know we don't have much time, but go ahead and over to you. Thank you. Tishan? I think you need to unmute.
Uh-oh, apologies.
There you go.
Okay. So, Mariana, thank you so much for that introduction. And I also want to thank my colleagues who've gone before and just really given a lot of insight into the work that they're doing and their experience on the ground. So this evening, I'm just going to talk to you briefly about GBV coordination and what we've been able to do so far. Mariana has already introduced this slide. So Tommy, I'm asking you, can you please move to the second slide? Thank you. Okay, so what I want to talk about here is just the different coordination leads that we have. So at the global level, we have GBV coordination, which is led by the GBV Area of Responsibility. It's headed by UNFPA, and it's also co-led by UNICEF, and it's in conjunction with the Global Protection Cluster. And that is really just to ensure that there's a response, a humanitarian response to the refugees as well. And then in the refugee context, we have UNHCR that leads coordination, and it structures, the sectors and working groups based on the refugee coordination model. What is really important to understand about coordination, and we touched on it earlier, we are a people that do things that might be on an informal level, but whether there's a formal structure in place or not, coordination is essential. Ensuring that we pull upon each other and we really look for collaborative efforts is really the way to go. Can I have the next slide, please? May I have the next slide, please? Okay, great. So let us look briefly at some of the core functions of the GBV Coordination Group. So it's to build national capacity in preparedness and contingency planning, to support robust advocacy, to plan and develop a regional GBV strategy, and to support service delivery. And at just different levels of the emergency, what we do in the coordination group is really how do we support the national government and national agencies in responding and preparing to the crisis. And advocacy, when I think of advocacy, I want you to think just a bit about the refugee crisis and how the different countries are dealing with it. In some spaces, there's a rise in xenophobia because, of course, we are all being impacted by multiple crises. We have the COVID pandemic, we have a rise in gender-based violence, a lot of people have lost their jobs, and on top of that, we have this large influx of refugees into our shores. And we need to do a lot of advocacy with the government just to really speak about the impact of, multiple vulnerabilities that come together that present in a refugee or a migrant that may be vulnerable. And also, how do we help them ensure that they get access to services to respond to gender-based violence? We also want to look at developing the regional strategy. And really, it's about just understanding what are the different needs amongst the different, okay, thank you. What are the different needs in the countries that we listed earlier, and just kind of coming up with a strategy that really informs and directs the actions and decisions that we take along the way. And then, of course, support to service delivery. May I have the next slide, please? Okay, great. So in the coordination group, what we really want to do is focus on ensuring that there's a multi-sectoral response. So what that means is getting a range of actors on the ground, from the national NGOs, the internationals, the civil societies, government actors, on the subnational and the national levels. And we also want to ensure that the actors engaged in coordination are familiar with the GBV guiding principles, because as part of the standard for coordination, one of it is that we have to ensure as the subsector mechanism, we have to ensure that members adhere to the GBV guiding principles and they understand just the key protocols that guide the response to gender-based violence and emergencies. We also just need to make sure that this happens so that we can, of course, anticipate the possible risks that can happen, and also just find a way that we can really just provide a better service to the population that we serve. And then we need to ensure that the humanitarian community is absolutely well-versed in understanding the manner in which we can respond to gender-based violence in a way that really upholds the survivor-centered approach. May I have the next slide, please? Thank you. And then just really going into the accomplishments to date. So as one of the key actions to GBV coordination, we deploy the subsector coordinator and the subsector coordinator. So we started at the last quarter of 2020. We also have had several meetings, and of course, just really following the minimum standards. We have to ensure that they are accessible, that there's accountability, that there's participation. We have updates from the different participants and memberships in the group, so we understand really what is the context on the ground. Another accomplishment is that we have a draft TOR for the subsector, and also in the Guyana working group, they have signed the TOR, which is the terms of reference, which really guides the workings of the group, and it sets out what would be the activities of the group, and a work plan, and really guidelines on the functioning of the group. We've also been able to identify regional GBV focal points, which we have spoken about earlier, about just the need to have a focal point, to have someone of people that really we can go to in the middle of an emergency and know that this person can give me accurate information because they are the ones that, you know, hold it together. Then we've also been able to just come up with a list of capacity building opportunities for 2021, because one of the things that is really important is to ensure that all partners are up to date, kept up to date on what the guiding principles are and just all the other key information and knowledge that we produce in this sector. So we can do this through the capacity building. And this will also respond to the gaps in service provision as well. Another one of the accomplishments, which we will be presenting in the next meeting, would be the analysis of the regional activities for the R4B platform. And as Mariana spoke about earlier, the R4B platform is the response to Venezuelan. And we've asked each country, a part of the platform, to submit the activities for 2021. And I'll present that analysis to the group to see, you know, what areas do we need to really ramp up activities on. Then we're also just, one of the other accomplishments, just disseminating knowledge products. We are in an interesting time. It's a COVID-19 context, and there have been so much, you know, information coming at us. We've had to, for example, switch to remote service provision. So the GBV AOR that I mentioned earlier on is really full of a lot of new product, new knowledge products, information, new data, and new just experiences that people have had on the ground, and how have they used best practices to respond to those needs. So we'll continue with that. May I have the next slide, please? And then also just some of the accomplishments, again, different linkages with different sectors. So we link with the protection sector, the child protection working group. So that has been an important achievement. And also just, you know, the continued promotion of adherence to the international standards for GBV prevention and response programming. And this, I cannot stress this enough, but we really have to ensure that all the partners are aware and they just adhere to the best practices. Okay, next slide, please. Looking to the challenges. So in every context, in every situation, in any new relationship, we will have challenges because we have multiple persons, multiple backgrounds, multiple agencies and policies and protocols. So one of the things that we've had to deal with, you know, just dealing with a bureaucratic national system, that has been a challenge in some areas. Also just a barrier, some of the barriers that have come up really because of a political climate that are so evolving at times that it really makes it difficult to get service provision. And then the last one at the top, or the first one if you're reading coming down, just conducting GBV service mapping in spaces with limited resources. So that has been one of the challenges. And for challenges, I really look forward to finding solutions. So I'm looking at it through that lens. So my hope is that for 2021, through collaboration, of course, we can really respond to these challenges identified here. May I have the next slide, please? Okay, lovely. And we are now looking at the way forward. How do we chart the course for 2021? So it's important that we really establish linkages in key sectors to ensure that we have GBV mainstreaming at every point. So even if it's a sector that's working on food security, I want to make sure that the lead in food security understands why it's important for us to have, you know, a GBV focus in that. In mental health sector as well, the psychosocial support sector as well, it's absolutely important. So these are some of the key sectors and working groups that I really think that we need to, not think, but that I really wish to focus on creating connections with them. And then again, it's an evolving context. So continued dissemination of knowledge products and information on risk mitigation and action. And then of course, just developing the subsector work plan for 2021. And we can go to the next slide, which will be the wrap up. Thank you so much, everyone, for lending your energy and being here with us.
Kishan, thank you so much for that very comprehensive presentation and for sharing your experience leading it's not an easy task, coordination, but I think you're all doing an amazing job. Thank you for sharing your experience and how you have been able to implement the minimum standards in your work, how this has made it easier for you, and then again, for all of the other panelists. It has been an absolute pleasure to have you here, sharing your experiences, sharing your time with us. And I hope that it has been inspiring to other participants to also please take a look at the minimum standards, read them, talk to other GBV practitioners, share them among your networks. This is important. This is going to make your job easier. And it's going to mitigate risks for GBV survivors and the communities that we serve. So would there be any questions? I don't see any questions on the chat box. I know that there was a question about availability of the public resources of the service mapping across the Caribbean, and currently, and unfortunately, we do not have this public resource yet, but you're always welcome to contact us directly through either your national focal points for UNFPA or myself, and I can give out my email address below if you have any specific questions. Please feel free to reach out to us, to the panelists, or to myself, or to UNFPA for further guidance. You can also, I've shared the link to the GBV AOR website, where you can find all of the resources that are available for you, not just the minimum standards, but other guidances and resources, other webinars that have been conducted throughout the 16 days of activism that has been really interesting to hear from, the same as here, this opportunity to hear from partners in the Caribbean. We've also heard from partners all over the world implementing the minimum standards, good practices. We've heard from really amazing technical specialists around the world who have shared their experience and their guidance. So it is important, and these resources are available for you at the GBV AOR website. I've shared it with you. The recording of this presentation and all the materials are also going to be uploaded to the website, I believe by tomorrow or the day after tomorrow. So you can access them as well. And yes, I'm not sure. Let's see if there's been any other questions here. Great presentation, Kishan. Okay. Thank you so much for the very lovely feedback. And I'm glad that this has been informative and that it has inspired you. We have a question from Caleb Orozco. Oh, I lost it. How does UNFPA deal with same-sex intimate partner violence? Is that in any GBV plan of action? Yes, and well, this question is a bit broad, but usually it's the same response to intimate partner violence from different sex and the same sex, right? Like, it doesn't really matter who the perpetrator is or who the survivor is. The response is always the same, right? We are usually, our focus and our approach is on the survivors, be it from whichever sex that you want or gender orientation. The response is always the same: survivor-centered. The availability of services are there for everybody, regardless of their gender orientation or sex. We don't really deal with the perpetrators when providing, for example, case management services. We do work on GBV prevention, which is basically aiming at perpetrators, but we don't work directly with them, right? Our focus is women and girls who are the most affected by GBV, but the response is always the same. It's not going to be, there's not going to be any differences when it comes to your gender orientation or the same-sex partners or abuse within the same sex intimate partner. I don't know if that was clear. Let's see. Thank you, thank you. Does it have any plan to revise law to address access to protection orders. Does it have any plan? Does UNFPA have any plan to revise law to address access to protection orders? We actually work in the Caribbean. We are implementing the Spotlight Initiative, which is not a GBV in emergencies response, because when we are responding to an emergency, we don't really have enough time to, be revising the national legislations of the countries, right? We need to respond immediately, and it's like first line response, right? So this is basically a bit more of a development and longer term intervention, but we do work with the governments. We are supporting them in advocating for policy change so that it serves survivors of violence, and so that we can modify the available resources, the available policies and legislatures to serve the interests of survivors, right? So that everybody can access safe, confidential, respectful, and non-discriminatory services depending on their needs. So yes, we do have this plan. It's a bit more broad to explain, but you're always welcome to contact us to further learn about the Spotlight Initiative, which is not an emergency response, it's more development. And we're actually working through an interagency, of course, implementation of this program on changing the justice system and legal protection systems in the countries. I don't know if that answered the question. Cynthia, I think Cynthia wanted to respond to Caleb as well. So Cynthia, you're free to unmute yourself. Go ahead and complement that.
Right. Thanks very much, Mariana. Definitely, one of the processes that the National Women's Commission is a part of is a legislative review in partnership with the National Committee for Families and Children, where we're looking at multiple legislation, including the Domestic Violence Act, as well as the FACA, which is the Families and Children's Act, and other legislation where we believe we can make some recommendations in terms of changing certain aspects of it to strengthen it and ensure that survivors are able to access better protection systems. So we definitely are undergoing that process right now. We have finalized the criminal code. We are currently looking at FACA, and then, like I said, we will continue with Domestic Violence Act. We have the Sexual Harassment Act, Evidence Act, and multiple legislation that we're reviewing.
Thank you, Cynthia. Tishan, would you like to complement that answer as well? Feel free to.
Thank you. Okay, so just responding to the question on intimate partner violence with members of the LGBT community. So when we developed the referral pathway, especially in Trinidad and Tobago, we tried to really highlight organizations that were LGBT friendly, because we do understand how important and how delicate it is, to come forward and say, listen, I'm LGBT and I also in a relationship with domestic violence and I need support, and people do not want to feel humiliated in any way. So in the referral pathway, there are key organizations that respond to that. So that is how we've built that into our response. I hope that helps with the response, with the question from Caleb, I think, yeah.
Exactly. Thank you. Yes, I think that Caleb is satisfied with the answer, but please feel free to reach out to us for a more comprehensive response if you feel the need for it. Thank you so much for the question. It's actually very, very important for all of our responses to be inclusive, right? And to include all of the different persons that may be affected by GBV. I don't think that there are any more questions that are currently being asked. So please do reach out to us if you have any further questions. And I'm just gonna let you go now because it has been almost 2 hours and we went over time. Thank you again for all of the panelists for lending us your times and your voice. And it was a pleasure to have you here. Thank you for everybody to have also dedicated your time to be here today and to listen to your colleagues, to our colleagues in the region. And yeah, happy day. Thank you very much for joining us, and until next time.